So are you going to?
Okay, we'll record the session.
Okay.
Thank you so much. And I will share now the material. Okay, so you will have 4 minutes starting from now. Go ahead. If anyone wants to do the station of Dr. Niha, please try and prepare it. Dr. Niha said that she doesn't want to do it. She's not going to be able to do the station. So you feel free to anyone to book it, even if you have already booked the station. Okay, ready?
Yes.
Okay, so let's say that my name is Robin. I'm the son of Mr. White. And we will start the station right now. 1, 2, 3, go.
Hello. Yeah, it's Robin.
Hello.
I'm Iman, one of the doctors working in the mental health. I understand that you want to speak with me about the condition of your father right now.
Yes, yes, doctor. I'm very worried about him. I don't know what happened to him. He used to be very reputable and a very, very revered man. Now he's doing totally nonsense and very risky things. And he has totally changed and all this happened within more than 1 month.
Yeah. So I just want to make sure from you what the behavior and the changes that you noticed recently.
Well, he changed, doctor. He became very reckless. He's spending too much money, took a bank loan. And, you know, he is talking about a lot of plans. He is investing in a new property which he cannot afford. He's talking about some relation with the royal family. And he is speeding. He's not sleeping well. And we took from him the car keys because he did a couple of accidents within less than 1 week. And he's very irritable most of the time.
Yeah, this is very concerning, isn't it? So I'm wondering if he has anything like this before.
No, this is the first time for him to have such symptom.
And did you notice before that he has any depression when he is withdrawn or has being sad or something like that?
No.
Okay. Is he have been seen by psychiatrists before ever?
No, this is the first time for him to be assessed by a psychiatrist.
So I want to discuss with you what we have done and about his condition right now. So about your father, we have done all the blood tests and investigations needed, and also we have done a brain imaging to exclude or see if any underlying physical problems, and fortunately all comes normal. So do you know if he have any physical health issues?
No, no, as far as no.
Okay, is he taking any medication?
No.
Right. Do you notice by any way that he's taking any substance or street drugs?
No.
Any alcohol at all?
No.
Right. So from what we have from the history we gather from you and the presentation we see in when we examining him, as you mentioned, that he's not sleeping, he has a lot of plans, he doesn't feel that he needs to sleep, he's very irritable in mood, and as you mentioned, also he has believes that he has some connection with the royal family, which is unreal belief. So from all that, we think it is most probably he has a manic episode with some psychotic symptoms. This is a part of disorder called bipolar. Have you ever heard about that?
No. What is this manic episode? What could be the reason?
Yeah, actually, there might be a lot of reasons or causes can cause this. One of them is genetic, maybe. Do you have any family history in your family with mental illness? Also, some other contributing factors like substance or something like that. And also stressors can contribute to that. But at the moment, the most important thing to think about how we can treat him. Are you with me so far?
Yes. So, well, I'm just wondering, so could it be an acute confusion?
Actually, from the assessment we have done and the investigations, the blood test, all his blood test is all right. So this excluded any physical, underlying physical problem. So that's why we did this in the beginning. We exclude with the blood test and the imaging, the brain imaging, that he is not in a confusional state at the moment.
Can I sign? I know he is in a very, very bad condition. Can I sign a consent on his behalf in order to admit him? الو ايوه يا عم علي. هو امرني يا سيدي. طيب ماشي، هات لي الورق.
Return back.
Sorry for the interruption. Please continue.
So yeah, as I mentioned, no one can give this consent on his behalf. So I need to do a recommendation for his admission, and we need to request another doctor to put another recommendation, which is called Mental Health Act assessment.
I see. So how are you going to help him?
Right. So the first thing is he needs to stay in the hospital so that we can contain the risk and assess him and closely observe his behavior. And the first thing, we need to start him on medication. So as he's experienced now manic episode, and he also have this unrealistic beliefs, which is psychotic symptoms. So I think we can start with antipsychotic medication to help him with his mood and his beliefs as well. And I'm thinking about something like quetiapine or olanzapine. Those are antipsychotic medication which can help him with his current condition.
1 minute remaining.
So this is the part of the medication. We also need to think about other aspects, like he's completely lack of insight at the moment, so we need to psycho-educate him about his illness, and also we need to speak with the family, you and the other family living with him, about this illness and how we can help him. And at the time of discharge, we might think about the discharge plan and how we can support him in the community by follow-up and maybe occupational therapist assessment of his living conditions.
Time. So how do you feel about what you did? Give me a rapid assessment of yourself. Please help her, give her some feedback. Pay attention to the feedback of your colleagues. Very valuable. They are all experienced psychiatrists, and most of them also are experienced in the CASC. It will be helpful to see their feedback. So as for my feedback, please pay attention to the following. The station is not the CASC is not an oral exam. Once you start putting your mind that they are challenging your communication skills, so once you start the station and you start hearing my complaint, show any sign of empathy. This is one of the communication skills. Once you start to hear the complaint of the patient or the relatives, show empathy, say any sentence which express that you understand the experience of the role player. You were very formal. I didn't feel that you were interacting emotionally. You know, the appropriate emotional tone was not there. You were, in the beginning, you were not very organized. You took for me some information to understand the condition, and then you started the explanation, and you came back again to gather some more information. You were repeating what I've just said and what is written in the notes, and this is not the best way to do the station. You only have 7 minutes. So you focus on what you need to do and what you need to know in the station, and definitely repeating what is written in the notes is not one of them. You were using some medical jargon from time to time, and the causes of the presentation. What is the cause of elderly mania? It was not an accurate answer, and you did not formulate. Pay attention to this feedback. From my experience, formulation is very important. Being disorganized and having lack of communications are very common causes of not to pass the station. Let's see the feedback of our colleagues. Pay attention to what they are going to say. Risk. Next. Okay, so only Dr. Anas. Okay, so let's see. According to the notes.
So do I need to ask about other risks as well?
You just show that you are a safe practitioner, ask about the risk, how is it? Okay, so, but basically it is written in the station that he is risky. Just show that you want to know more if there are any safety concerns. No more details more than this question. So in the beginning, you want to gather some biopsychosocial information, because this is our plan if you are going to follow my notes. So the first step is to introduce yourself, and this is a very simple task, a simple skill, and though it is very simple, sometimes the candidates do not know how to do it. It just simply you identify yourself, greet the patient, or vice versa, greet the patient and identify yourself, and then explain why you are talking with this man. And though this is very simple, the candidates sometimes they forget to greet the patient, or forget to identify themselves, or even they forget to explain why they are talking with the role player. And all of them shows that you don't know how to start a consultation. So pay attention to the introduction. It is not a trivial thing to pass. The second step in our plan is to gather the biopsychosocial information and the level of risk, because these are very important information which will help us later on to formulate and to set the appropriate plan. Pay attention to the psychological information, which most of the candidates miss. We want to appear distinguished from the other candidates. We know that this man is old, and there are some reasons which can have the same presentation, like frontal lobe dementia and also confusion. So the most important information, psychological information, which you need to know in order to complete the picture, is whether he has confusion or no, and whether he has memory problems or no. So ask him if he appears disoriented from time to time, if he has any social problem, any memory problems. So these are the psychological information which you need to know. And now you want to know about his social circumstances, and finally the risk. So these are the biopsychosocial information which you need to know in order to complete the picture, in addition to what is already given to you. These are information which are already given to you. You don't need to repeat them in the station, okay? But there are some missing information which you'll be asked about later on. In order to make sure that you will answer them, you need to cover this information, because in the station, this particular station, the role player is going to ask the candidates whether the father is having confusion or no. And this is a question which they didn't know how to answer. They will answer it if they gathered the right and asked the appropriate question when they were gathering the biopsychosocial information. You want to know if he appears disoriented to place and person, which he is to know, and if there are any memory problems. Okay, socially, just simple question. How about his social circumstances, any stresses and risk, any concerns about his safety, which you'd like to share with me? And then regarding the explanation, you are going to explain that this is a manic episode with psychotic symptoms. You cannot say yet that it's a bipolar mood disorder. It is a manic episode with psychotic symptoms. Explain what is manic episode and what are the psychotic symptoms. Okay, and then pay attention to this question, which I feel that most of the candidates don't know how to answer it. What could be the reason for this? Okay, the manic picture in the elderly have several reasons, but we all know that there is no particular cause, but there are some factors which increase the chance of having this problem. If there is past history of psychiatric disorders, okay, if there is a sort of dementia, frontal lobe dementia, strokes, okay, hormonal, thyroid hormone disturbance is very common to be associated with mood problems in the elderly, and finally, the deficiency of vitamin B12. Okay, however, because this man has already done a lot of investigations and is medically cleared, most probably the main reason is the psychological disturbance, which is a manic disorder, manic episode with psychotic symptoms. And here's the question: can it be an acute confusion? You cannot answer this question except if you have already established that this patient is oriented to the place and time. Okay, are you with me, doctor? These are the questions which you are going to be asked in the station. I've gathered this question over time from the candidates who passed the task, and I'm trying to put them to you in your hand. Can I sign a consent on his behalf? Just show your empathy, understand. You answered quite well, good, but you don't need to say that we need another doctor. Just say that if he refuses, we might consider the use of Mental Health Act. This is enough. And when he asks you, how are you going to help him in this, before going through the steps of the management, squeeze the formulation, because the formulation is the very first point which you are going to be assessed for while you are doing the task. So when he asks you, how are you going to help him, before going through how we can help Mr. X, I would like to highlight the most important points in Mr. X condition, which we are going to work on. So Mr. X is having a manic episode with psychotic feature. This is the first episode. High risk because of his mental state, all this on the background, having no medical problems or past history of psychiatric disorders, okay? I forgot to write here the manic episode with psychotic symptoms, okay? Any questions, Dr. Iman?
No, that's fine.
I'm talking fast, and I hope that what I'm saying is clear.
Yeah.
Now we are going to start how we are going to manage the patient. Pay attention when you reach the step of management, or when you start talking about the management. Most probably, if you are very good, you will not have more than 90 seconds or 1-2 minutes maximum. So you must be very organized in order to make sure that the 2 minutes or the 90, even the 90 seconds can cover what you need to say. So the first thing which you are going to do is to say, what are you, Dr. Iman, what are you going to do and where the patient is going to be treated? Okay, I'm going to see Mr. X myself. I'm going to explain his condition and the management plan and to address his concerns. This is very important because there is a point in the mark sheet for those who are interested about the patient's health view, those who are interested in having this collaborative approach with their patients. So when you say, I'm going to see the patient myself and do so and so, definitely this is going to be scored for you. And where he's going to be treated, you must justify that because of the high risk, he's going to be treated in the hospital. Now, regarding the investigation, so this patient is already medically cleared, but you want to know more information, whether it will be helpful to do some urine drug screening, heart tracing, thyroid function tests. These are not the routine investigations, okay? So you want to do them in order to make sure that there is no factor which can be behind this clinical picture. Are you with me so far, Dr. Iman? Okay.
Yes.
So be very organized when you start talking about the management. This is very important. First thing, where the patient is going to be treated and what are you going to do. Number two, the investigations. And as I said, don't repeat the same investigations which he already did, but you want to show that you are distinguished, you are different from the other candidates. You want to know if this man is having a thyroid disorder. It is very common, if any one of you is working with elderly, very common to have in them to have a thyroid disorder. Very, very common. Okay. And also you need to exclude urine drug screening, and very important also to make sure that the heart tracing is there, because we know that our medications affect the heart. Now, very important after that to say this sentence: there will be a team which will cover all his needs, physically, socially, and psychologically. Why is this? To show the examiner that you are a type of psychiatrist who will cover a patient in a comprehensive way. It's not only about the symptoms, and unfortunately, this is what you did. So psychologically, very important to put the patient in observation. We need to put him in a safe place. This patient is risky. Very important to consider that this patient is risky. So when he is going to be admitted in the hospital, he's not going to be admitted as any other patient. This patient is risky, so he'll be in the observation to make sure that his observation is safe, his behavior is safe. Then regarding the medications, you must talk about a short course of benzodiazepine to control his behavior, to improve his sleep pattern, because if you read the scenario that this patient is not only irritated, but also have impaired sleep. And then the backbone of the treatment, as we all know, is a mood stabilizer. Are you with me, doctor? Are you following me? I'm trying to talk rapidly because there are a lot of things to say. So if you miss the track of what I'm saying, please, you can stop me. So the backbone of the treatment is to use a mood stabilizer, and there is a different. Okay, and there are different medications can be used, like lithium, sodium valproate, and quetiapine, and each one of them has its own pros and cons. You will give leaflets and about them. If you are to add a cherry on top and to show that you are experienced and professional psychiatrist, mention that olanzapine and risperidone also act as mood stabilizer, but they are not recommended in the old age. Okay. Lastly, if there is no improvement, you can use 2 mood stabilizers, and eventually you can resort to clozapine or ECT if there is no improvement with all the medications which you have used. Are you with me, doctors? Everyone is with me? Everyone is following me? Any questions? This station is very important, and unfortunately, though it is very clear, very simple, very direct, the pass rate is not that high, because as you can see, there are questions which are not answered accurately from the candidates. Okay. Physically, if there is any physical problems, you are going to consult the physician. And socially, when the pain, you must, if you are going to admit the patient, you must talk about the condition of discharge. So yes, I admitted the patient. So what, is he going to stay in the hospital forever? You must talk about the discharge. So when his mental state is stable and the risk is low, he is going to be discharged. And after discharge, a nurse is going to follow him up to make sure that he's taking his medications and to detect the early signs of relapse. Very important to talk about the community treatment order to make sure that this patient is taking his medications. And finally, talk about the leaflets. As you can see, a lot of things to say in the last 90 seconds or the last 2 minutes. If you are very clever, so you must be very organized. Let's see the mark sheet, and make always your references mark sheet, whether you are using my notes or whatever source you are using, because it's all come down to this mark sheet. So, and as you can see, so this is the first thing you are going to be scored for, Dr. Iman. Did you formulate? Unfortunately, you did not formulate. And formulation is a clinical skill. If you want to know more about this, you can watch one of my videos about the formulation on my channel. How to formulate is a very, very important, and it's very simple, but you need to establish that you know how to do formulate in the station. Unfortunately, you did not do this, so this point is not going to be scored for you. You recognize the significance of findings and result. The management plan, unfortunately, we did not talk about if the patient is not responding, what are you going to do? You did not talk about the combination of 2 antipsychotics. You did not talk about the use of clozapine as an alternative for the resistant cases of mania, or the use of ACT. As you can see here, does not pay sufficient attention to the patient's health view. If you said that I'm going to talk with the patient myself, definitely this point is going to be scored for you. Number 5, does not develop
the patients already have been seen.
As you can see, when you say that I'm going to admit him is good, but also you must say that when he's not going to be discharged except when the risk is low. So this point can or cannot be scored for you, okay? Does not identify appropriate psychological and social interventions. You talked about psychological and social interventions. And so regarding the communication, it was a bit disorganized. It was formalic. You did not show empathy. Does not show appropriate. No, you did show appropriate listening skills and appropriate use of cues. And questioning style, everything was good, but except that it was formal and disorganized. Okay, so I hope that it was clear for you, Dr. Iman. Any questions? Yeah. Any questions in the chat section?
It is only thing that I have already seen the patient, so I don't think that we need to say that I'm going to see him. I'm already saw him.
Yes, you said you are going to see him to explain the management plan. You already you have seen the patient to assess him, and now we are going to see the patient to explain the management plan and the need for him to be staying in the hospital. Don't take him directly to the hospital without giving him an idea whether he accepts or not. This is something else. Okay.
Yeah.
Any questions from all the candidates? I hope that this station is clear. Very simple. And though it is simple, as you can see, there are a lot of tricks in it. Pay attention to the causes of the manic picture in the elderly. Pay attention to this. Okay, thank you so much, Dr. Iman.
Okay, thank
Who
you.
would like to go next?
I will go next. It's morbid jealousy management.
Okay. Yeah, I'm ready whenever you're ready.
Yeah, I can start. I'm okay to start. I'll call you as a Mrs. X.
Let's say that my name is Mr. Mrs. White. Okay, Mrs. White.
Okay, Mrs. Y.
1, 2, 3, go.
Hello, Mrs. Y. I'm Dr. Suram, one of the doctor in the mental health unit. Today, I understand you came here to discuss about your husband's partner. Am I right?
Yes, doctor. What is wrong with him? He has changed so much.
Yeah, actually, I have already seen him, and then I would like to discuss more with you. But do you mind, before that, do you mind sharing what actually happened that led him to come to hospital?
Today he was so agitated. He had a knife and he was stabbing a pillow. So I said that he must talk with someone in order to make sure that he's okay.
Okay, so you see him quite agitated, stabbing the pillow, and do you know the reason why he was doing that?
No, what's wrong with him?
Yeah, before that, I would like to ask you more questions. And then is it something that is this the first time you saw him like that, or did you see this similar behavior in the past?
No, this is the first time.
So you're not very sure about what's the reason.
Yes.
I can see that you're a bit concerned about your husband and not very sure what was the reason. And I talked with him, and he states that he strongly believed that you are having some affair with the neighbor. Did he talk to you about anything about it?
He is talking about this from time to time. I think that is something related to his jealousy. He's jealous, and I understand this, and sometimes it is a bit more than what is accepted. But I think that he's not that bad, doctor. Can you allow him to go back home, please?
We will discuss about it later. So before that, I would like to discuss with you, give you more information and understand more about her. And you states that he was stabbing the pillow and quite agitated, right? And
Yes.
from my interview, he seems like he's very strongly believes that you are having the affair with the neighbor. What do you say about that?
Again, what did you say?
I mean, he strongly believed that you are having affair with
Well,
your
he is just jealous, doctor. I don't think that this is more than jealousy.
so you don't how do you see that? Do you see that as a quite concerning? Like he was having the belief you are having affair, and at the same time he was agitated, stabbing the pillow. How do you see that?
I feel that this is something normal. He's just jealous.
Mm. And I would like to ask a few more questions about his past. Do you know anything about his anything about his past mental illness or issue with the past relationship?
No.
Mm. And did he ever did he ever become any aggressive with you?
No, this is the first time for him to show its
Mm.
behavior. That's why I was very worried.
Yeah. And from the information that I got from him, he states that he had a previous relationship about 4 years ago, and during that time, he had this similar kind of jealousy, and he had stabbed his previous partner. So this is quite concerning for me. And at the same time, this time he also shared that he was carrying a knife with him.
Yes. He was carrying a knife. Yes. So, but I don't think that he is going to do anything, doctor. Please, can you allow him to go back home with me, please?
Yeah, I can see that you're very eager to take him home, but we will discuss about it in a while as well. And given the situation that he has a very strong belief that you are having affair, and at the same time carrying a knife. And in case if he is able to find some evidence, he is planning to confront and take further actions, such as harming you or a neighbor. So it's very, very concerning. You can see that as a very concerning. And
I don't think. Please allow him to go back home with me, please.
And the further information also makes this as a high risk, such as previous history of violence associated with similar relationship issue, and he was also taking the medication called risperidone for his mental health.
So what could be the reason for this problem, though?
So it seems like this is what we call as a delusional jealousy. And the delusional means that a person is having the very strong belief despite not having any evidence. So his belief that you are unfaithful is very fixated. And the risk of harm to you or the neighbor is very, very high at this state. So yeah, we are very concerned about your safety and his safety as well. And therefore, yeah. Do you know about does he consume any alcohol or any strict substance?
No, doctor, no.
And I can understand that you are very concerned about him and you want to take him home, but at this stage, I strongly believe this is not safe. It is not safe to take him home because of the high risks.
So how are you going to help him?
Firstly, like we would like to suggest the short-term and long-term plan. First of all, we would like to keep him in the ward, admit in the ward, and would like to start him on the antipsychotic, which will help him, and we would like to optimize that. And and with the time, when he's stressed, his strong beliefs settle down, then we would consider about sending him home, so that when the conditions are safe.
I see. 1 minute.
And if he agrees, that is good. But if he don't agree, we will have to admit him under the Mental Health Act, which happened in the past as well. And once his acute condition is settled, and when his condition is settled, and when we find it safe, they would like to discharge him, and then we would like to follow him up in the long term to make sure he remains healthy, mentally stable.
Fine.
Okay,
How do you feel about what you did? Give me feedback about it. Please, doctors, give him feedback. It would be very helpful to give each other feedbacks. Okay, so give me your feedback about what you did.
Okay, so I think I should be more fluent with the my interview should be more smooth, and some of the information may not have been very clear, but it was a very good learning. Just thank you.
Okay, so first of all, as I said, always show empathy early on in the station. You don't need to show empathy all along the station. This is not a session of psychotherapy, but make sure that in the beginning of the station, when you interact with the role player, show empathy, show that you understand the experience of what she's passing through. Okay, I felt that you did not show this. When I said, what is wrong with him, you did not answer me, and you said it clearly, I will answer your question, but I want to know more about so-and-so. This is not the best way to interact or do your consultation. Your priority is answering my questions, and after answering them, take me back by signposting that after so after answering that, you can add a sentence. So I would like to check about so-and-so after answering my question, and return back to the point which you want to cover. You did not formulate, and this station, doctors, is primarily about the risk management. So if you did not show a considerable amount of risk management discussion in the station, most probably you will not pass. understand the essence of this station is about the risk management. So let's see how we can do this station. Okay. So this is the morbid dialysis station. This is a very common station, by the way. In general, doctors, unfortunately, the passing rate in the management station is not high, because as you can see, there are some requirements from the candidates which they do not meet, so the passing rate is not high. As we said, it's very important to start with the introduction. These are our points which our management plan: introduction, gathering biopsychosocial information, risk, explanation, formulation, then management. So these are the 5 points which you are going to go through in order to make sure that you will cover all what is required from you in the station. Okay, then explanation. If the role player starts to ask questions, because in this station she will immediately ask you, what is wrong with my husband? So you must address her concern before gathering information. So you can either start by gathering the information or explaining the problem of the patient according to the flow of conversation. But make sure that you are going to do the both. So explanation, you explain the morbid jealousy, that is a delusion, and you must say that did you say that it is a delusion and it is a psychosis and so on? Hi, hello, did you say? Okay, so when she asks here what is the cause of morbid jealousy, what is the cause of schizophrenia, what is the cause of bipolar mood disorder, this is a typical answer. There is no particular question, but there are some factors which increase the chance of having this disorder, like chemical imbalance, the brain, past psychiatric history, family history of mental health problems, and also it is more common with particular disorders like alcoholism, cocaine, and vitamin dependence. This is particular for the morbid jealousy, more common with alcoholism and cocaine and amphetamine dependence. Pay attention to this information because you want to appear different from the other candidates. You don't say the regular things which are going to be said, so that you show that you're more professional. You know that this type of disorder is more common with substance misuse, the morbid jealousy, and some organic brain disorders like Parkinsonism, schizophrenia, and definitely personality disorders. Okay. Are you following me? Everyone is following me. I'm trying to talk fast because there are a lot of things to say. Is it serious? Definitely. There is high risk. If not managed, it is closely related to harming the spouse or the suspected person. Okay? Be sure that you answer this question without ducking. Say it seriously. It is very serious. It is not managed. Serious to the patient and also to the spouse. To the spouse and to the partner, the third party. Well, she will argue that about giving him the dose of risperidone without increasing the dose of risperidone without admitting him. You must say that because of the risk, increasing the dose of risperidone is not high. All these questions you are going to meet in the real task, okay? She is going to insist more and more about him not to be admitted. So you must discuss with her frankly, Mrs. X, though there is a clear risk on you and someone else, why do you insist him to be discharged? This is something which can be very unsafe. Say it clearly, and this is something which they can dismiss. And you will discover that the Royal College is hiding something to make sure that you are someone who is paying attention to the role player or the patient's or the relative interests. So there are a lot of bills and financial issues which he is the only one who can manage. Okay, rest assured that we'll address this in the management plan. But make sure that when she insists on him to be discharged, on him to go back home, just ask her, so why do you insist, though there is high risk? Those who did this had a better chance in passing. Do you think he's going to get better? This is a very good common question in all the stations of whether the patient is going to get better or no. There are factors which help to predict the good outcome. This is a question about the prognosis. There are factors which will help to predict the good outcome, like early start of the treatment, the patient's insight, the absence of substance misuse and past psychiatric history, the absence of stressors and the good coping of stressors, and the good family support. All these are the factors which we know which support the good outcome or the good prognostic factors. And now you can take the lead, something which we know in the consultation and the communication skills is signposting. So gather the important information which will help you to do the formulation and also will help you to set the appropriate management plan. All what has been done before is simply explaining the problem. Now you want to know some information which will complete the picture for you in order to make sure that you will do the appropriate management plan. So you want to know more if he's taking his medications or taking any substance misuse, and if there are more information about life stresses, if there are any children, and how does he cope with the stressors, and physically, if he has any physical problem. Actually, you asked this question, but it was a bit scattered and not organized. And then the risk, ask him about any concerns about safety, which he wants to share with you. And finally, you will start talking about how to help him. And before talking about how to help him, you must formulate. This is a skill before going through how we can help Mr. X. I would like to highlight the most important points, which we will focus on in our management plan. So he has morbid jealousy, which is not controlled, and there is high risk from his mental state. All this on the background of previous violence to the spouse because of his morbid jealousy and consequent admission under Mental Health Act. However, we need to know more about his commitment to the medications, underlying substance misuse, and physical condition. As I said before, formulation of skill, unfortunately, is not present among most of the candidates. They don't know what is formulation. So practice it as much as you can before going through the exam to make sure that you will pass in the management stations. As I said, when you start talking about the management, most probably you will only have 90 seconds, 2 minutes maximum. Make sure that you are very organized in order to cover the most important points. The first thing, as we always say, talk about what are you going to do, doctor, and where the patient is going to be treated. So as we always say, you are going to talk with Mr. X to explain the diagnosis and the management plan and to do thorough risk assessment and address his concerns. And because of the high safety concerns, he's going to be admitted in the hospital. And if he is not cooperative, you might consider the implementation of Mental Health Act. Okay, are you with me, doctor? As you can see, these are repeated sentences. We are not going to say new sentences in every station. You are repeating the same things which you are going to say in every station, but make sure that you are organized, you have good communication skills, and these sentences will work in every station. You don't need to create new talk for every station. Make sure that you cover the task properly. So the second thing, you want to do some investigations, the routine blood, and when you talk about the investigation, don't say that he need to do some blood tests. Make sure what are the blood tests. This is a common mistake. What are the blood tests which he must do? The CBC, kidney functions, liver function, blood chemistry. Very important to talk about the urine drug screening, okay? And this will help to exclude the underlying medical disorder and substance misuse. Okay, are you with me? And as we say, you must say the team which will cover all his needs, physically, psychologically, etc. Physically, the same sentences of any underlying medical condition, you are going to consult the physician. Now, the psychological, the backbone of the treatment is to control his delusions and to set a proper risk management plan, okay? Very important to say this, doctor, because it's all about risk management. This station is about the risk management, exactly like the previous station is about the elderly mania. Why did he blink for you, an elderly patient, as a manic patient? Definitely, he wants to check whether you know the possible causes of this picture in the elderly. Okay, so you must understand what is required from you in order to make sure that you pass. So the essence of this station is to make sure that you are going to set the appropriate risk management plan, not only to control the delusion. So the dilution will be controlled by an antipsychotic, and which will correct the chemical imbalance. And if he is not going to be cooperative or with the medications, you might consider giving him using a long-term injection called depot instead of daily tablets. The risk management will include a short course of benzodiazepines, which will decrease his agitation and improve his sleep pattern. Okay, are you with me, doctor, so far?
Yes, doctor,
okay.
yes.
Now, the continuation of your risk management plan regarding the visits will be allowed after control of the risk. It will be supervised, and when his mental state is stable and the risk is low, supervised leaves will be allowed before the final discharge. And after the discharge, it will be helpful to apply a community treatment order, and he will be followed regularly by a nurse. As you can see, these are same sentences. Community treatment order followed regularly by a nurse for early detection of signs of relapse and safety concerns. And as you can see, it is very important to talk about the discharge, okay, because the discharge depends upon the low risk. This is a continuation of the risk management plan, okay? She has raised some concerns about his financial issues. Talk about an appointment with the social services to help her with this issue. Okay, and finally, share with her leaflets in order to make sure that she understands the problem. We will go through the mark sheet rapidly in order to make sure that you understand how you are going to be assessed. This is not a pass or fail. I'm not an examiner, but as you can see, you must know how this game is played, and this mark sheet has the rules of the game. Number one, does not formulate the problem effectively. Unfortunately, did not formulate it. Does not fails to recognize significance of finding and results. You did recognize the significance. The management plan, unfortunately, it was not good. You did not talk about the depot if he's not cooperative, and you did not talk about benzodiazepines. You did not talk about the proper risk management plan. So most probably, point number 3, 5 are not going to be scored for you. You did not say that I'm going to talk with the patient, so point 4 is not going to be scored for you. Psychological and social interventions, again, you did not plan for the discharge, so unfortunately, point number 6 is not going to be scored for you. It was not very organized. It was a bit formalic. Other than this, your communication skills were good. Don't be frustrated from the assessment. This will help you to understand how you are going to be assessed. Maybe you are very clever psychiatrist in your specialty, but going to the task is just a game. You know how it is played or no, whether you are professional, whether you have a PhD or no, whatever your experience is, it's all about knowing the rules of the game. And as you can see, the rules are here in the mark sheet. Okay, thank you so much, doctor. I hope that you found it helpful.
Thank you very much. It was very helpful. I will improve.
Thank you so much. So who would like to go next?
Me, can I go next, please?
No, can you just raise your hand or do something?
Me.
Okay.
I asked to go next, please.
Okay.
Thank you.
What is your station, please?
Patient on olanzapine. Nurse wants to start lithium.
ماشي, okay. لحظة بس يعني. Okay, you have 4 minutes. I hope that you're ready, doctor.
Yes, I'm ready.
Okay, we will start. Let's say that my name is Michael. I'm the nurse who's going to argue with you about the matter.
Sorry, I can't hear you, Dr. Hussam. Can't hear you.
You cannot hear me? Do you hear me now?
I hear you now. Yes.
Okay, so let's say that my name is Michael. 1, 2, 3, go.
Sorry, what's the patient's name?
Mr. Brown.
The Brown. Okay. Can I start?
1, 2, 3, go.
Okay. Hello, Michael.
Hello, doctor.
Hi, I'm Deborah. I'm one of the doctors, and I understand that you have some concerns about Mr. Brown.
Yeah, doctor. He is very problematic. He came 2 days ago. He is interfering with the patients. He's involved. He's always in their personal spaces. He's taking their items, not controlled by the medications prescribed by the consultant. He gave us the permission to discuss the lithium if there is no improvement. So I hope that you consider giving him lithium because it's not helping him to take olanzapine.
Okay, Michael, I can appreciate that it's quite a lot of stress for yourself and the staff, and I would just like to understand a bit more about what has been going on with him. So you say he's been quite irritable, restless on the ward. I was just wondering if you can tell me a little bit about what brought him to hospital.
Well, we don't know exactly, but what we know that he has been found in the streets making some chaos. The police brought him because some of them called the police, and I think he's continuing the chaos here. He has some history of being in contact with mental health services, but I'm not sure of the details.
Okay. And you say he's been going into, he's been invading other people's personal spaces. Has there been any harm to others? Like, has he
Well,
hurt anyone
up
by
till
any
now,
chance?
no, but the when this happens with the patients, it can be escalated at any time. This is not a safe circumstance at all.
Yeah, I appreciate it's important to keep both the staff and the other patients also safe. I was just wondering what kind of treatment he's currently on.
Well, he is taking olanzapine. Actually, he's hardly taking olanzapine, and actually, it is not helping at all, doctor.
Okay. So he started olanzapine 2 days ago when he came in.
No, yeah, one day actually. Yesterday, the consultant came, and we started him today. So it's only one day.
Okay, only one day. I wonder if there have been any things that could help that helps with taking olanzapine at all.
Well, no. He also, well, sometimes I feel that he is not willing. Once he tried to hide the medication under his tongue. He only took it 3 times maximum.
Okay. So, you mentioned that the doctor had said that you were hoping we could start him on lithium.
Yeah.
Okay. So I'm just wondering if he's had his blood tests or any
He
of
can hardly
those
help
done.
us to do any blood test, doctor. He's not cooperative at all.
Okay. So he's not accepting blood tests. How about things like checking his blood pressure or anything like that?
No, he's not helping us to do this either.
Okay. Are we aware of any physical health concerns he might have, maybe?
No, there are no physical problems.
Okay. So I understand that this young man, Mr. Brown, has a diagnosis of mania.
Yeah.
And at the moment he's presenting as quite restless, he's invading people's personal spaces. There's quite a risk to others from him. And he's on olanzapine, but he's not taking it.
Yeah.
However, he hasn't quite let us
Yes, and I really
do
feel
his
that he
bloods or
should
any.
start. Yeah, I really feel he should start lithium as the consultant recommendation.
So it's while I can appreciate the stress on the team and also the risk to others, at this point it might not be the best decision to start him on lithium straight away. And
why is that?
So the reason why I wouldn't is because, first of all, he has only been on olanzapine for a day, like you said. So I didn't ask how much he's taking. How much olanzapine is he on?
He's taking one tablet, doctor, twice, one tablet a day, one tablet.
One tablet again a day. Okay, so he's only just started it for 1 day, and we would usually want to try for a bit longer than that so that he is on a maximum dose before we think of changing the medication.
Yes.
Another issue is that he isn't accepting us to do blood tests. And it's quite important that we have the blood test done because of the risks and side effects of starting a patient of lithium. So,
I see.
and when we
So
start,
so how are you going to help him then?
well, one of the things we can do, you've said that he's taking the olanzapine and sometimes hiding it under his tongue. We can consider using the oral dispersible ones for olanzapine if he would accept that at all.
Yeah.
Alternatively, we can think of giving him some medication to help calm him down. So some benzos like clonazepam that could help to calm him if he would accept that as well. Are you with me so far?
Yes, yeah.
Okay. We could also consider other non-pharmacological methods. So we can think of things like maybe increasing his observation levels. What's his observation levels now?
I think, well, we did not take any particular order regarding this, but he is in the de-escalation room.
Okay. So I think you're
1 minute
already
remaining.
Okay, I think you're already doing the right thing by putting him in the de-escalation level. So if he's in maybe a quieter part of the ward, that might help to reduce the level of his agitation and irritability as well.
I see. Yeah.
Yeah. Do you have any further questions for me so far?
No.
Okay,
There's
so
something else which you can help us with regarding the instructions, definitely this will be helpful.
pardon?
If you have any instructions, so definitely will be helpful.
Okay, so we can also continue to monitor him and maybe increase observations. And if there's anything anywhere else that we can come in, I'm more than happy to support the team.
Time.
Thank you.
How do you feel about what you did? It was very good until you started talking about the management. It was excellent until you started talking about the management. So how do you feel about what you did? Give me an impression. Give us a feedback.
I don't know. I think for management, I didn't want to start him on lithium straight away.
Okay, so
I didn't think it was appropriate to start him
again,
on lithium
doctors, you
straight
think
away.
that the doctors, management stations is not only about giving medications. They want to check, are you able to take care of this patient? Are you able to talk about your management plan or no? Taking care of the patient is not only giving medications. Pay attention to this. Let's see
Okay.
how we are going to do this station. And please, doctors, if you have any questions or have any comment on the performance of our colleague, please put it on the chat section. I find myself very helpful. So your introduction was very good. I liked your empathy. It was a very good start. I like that the way you took the handover. You are dealing with a nurse. When they put a role player in as a nurse, this is not just for fun. They want to check whether you are able to talk with a colleague. Are you able to take a handover or no? And make sure that even you can address it in the beginning, okay, and say that I would like to take a handover from you about the patient. So you can say it frankly, because this is a medical professional, so this is not considered as medical jargon. Okay, sorry, this is I'm sharing with you the wrong. Give me just 1 minute to get rid of this. So As you can see, you are talking to a nurse to make sure that you take a hand over and you verbalize it to show the examiner that you know how to start a discussion with a patient or with a role player who has been taking care of the patient. So you want to take a hand over to understand more about the circumstances of the patient. And you did it very well. Okay, you wanted to know more about the social circumstances, psychological, but you missed the psychological. You want to know more about his diagnosis, if there are any visual hallucinations or auditory hallucinations, unusual thoughts. Okay, does he appear confused? A very important question. Does he appear confused? Okay, and if there are any information about the past medications. Other than this, it was a very good beginning that you wanted to take a good handover and you showed empathy and you had a very good communication in your start in the start of the station, and even your justification about for why he is not going to start on lithium and he should continue on olanzapine was more than perfect. Now, once I ask you how are you going to help him, you must do two things. You must do your formulation. Before going through how we can help him, I would like to highlight the most important points which we'll focus on in our management plan. As you can see, same sentences. So you want just say what, try to formulate. He has a manic episode and not controlled, and there's considerable risk because of his mental state. All this in the background of having bipolar mood disorder. However, we need to know more about his past psychiatric history, the medications, the physical condition, and the possibility of substance misuse. So this is your formulation, and this is the foundation of your management plan. So let's see the management plan. As we always say, you start by, what are you going to do, doctor? Dr. Diboyo. Is it your name, Diboyo? Diboyo. So what is your, what are you going to do and where the patient is going to be treated? You are going to see Mr. X to do mental state, physical assessment, thorough risk assessment, and also you are going to have a look at his past psychiatric history and the medications which which he has been using before. And this is the point which you have mentioned in your formulation. Okay. And for safety concerns, he's going to stay in the PICU until it is safe for him to go to the ward. He can leave the PICU under one-to-one supervision for 1 to 2 hours, because this will help to decrease his agitation and improve his relation with the medical team. So this is your plan. In the beginning, what are you going to do and where the patient is going to be treated? Number two, regarding the investigations, you did not talk about investigations at all. Very important. As long as you are going to give him medications, you must do investigations. We have routine blood tests and you must verbalize it. Don't expect that saying blood test, the examiner will accept it, because we know that we do only most probably liver function, kidney function, etc. No, say it. He needs to do liver function test, kidney functions, heart rating, blood chemistry, and very important to do urine drug screening. And if he is not cooperative, we can calm him down with lorazepam. Okay? Are you with me, doctor? So far, yes. Any questions, please? If you feel that I'm talking fast or any point is not clear, interrupt me.
I have a question, Dr. Sam.
Yeah.
In the first point where you said the patient can go out of the PQ,
yeah,
I'm just a bit concerned. Would we be asking for the patient that's agitated to go out of the PQ?
No, he's going to be agitated, escorted by escorted under supervision. 1-to-1 supervision. It is a 1-to-1 supervision for 1 to 2 hours. Do you understand how he's going to go out? Okay, because this will help him to decrease his agitation. And it is more risky to make the patient stay in the PICU for a long time. Actually, it is more dangerous to keep the patient in the isolation for a long time without sending him out from time to time. Very important to know this information. The risk is higher if you confine the patient long time without making him go out. Now, regarding the investigations, as I said, what you are going to say. Now, you must verbalize. There will be a team which will cover his needs, etc. Physically, if there is any physical problems, you are going to consult the physician. Psychologically, pay attention that you need to use a short course of benzodiazepine. Why is that? This will help the patient to calm down and improve his sleep pattern. Very important to say this. Calm him down and improve the sleep pattern by using benzodiazepines. If the manic symptoms were not controlled by 10 milligram olanzapine and the benzodiazepine course, consider increasing the dose of olanzapine. So the first step is not to increase the dose of olanzapine, and unfortunately, this is a common mistake in most of the candidates, that you increase the dose of olanzapine. No, you start by giving a short course of benzodiazepines, and if still there is no improvement, you can increase the dose of olanzapine. Ideally, the medication should have been tried with enough dose and duration. However, if still there is no improvement, we can add another mood stabilizers. If there are no improvement, you can consider clozapine or ECT. So this is a stepwise approach which you did not mention. So start by benzodiazepine, no improvement, increase the dose of olanzapine, no improvement, add 2 mood stabilizers, no improvement. Eventually, you can use either clozapine or ECT. Remember this stepwise approach, okay? Socially, if there is a need for some misuse team, please, doctors, could mute your mics, please. Socially, if there is a substance misuse issue, we can consider substance misuse team, and as well as information from the support and family members. When the mental, now the discharge is very important. As long as you mentioned that you are going to admit the patient and you mentioned the condition and the reason for admission, you must mention why he's going to be discharged. Just don't leave it like this, open. We are going to admit the patient. So what? You must mention that when the patient's mental state is stable and the risk is low, we can plan for the discharge. And a community treatment order will be helpful to avoid the relapse, and also there will be a nurse which will follow him up at home. As you can see, a typical sentence which you are going to say at every time you are going to admit the patient at all the stations. When the mental state is stable and the risk is low, you are going to discharge the patient, and you are going to implement a community treatment order, and there will be a nurse who will follow him up. Okay? Are you with me, doctor? Any question? Okay, so let's see how this mark sheet is used, and this will be the last time to talk about how to use the mark sheet, just to make sure that the time is more efficient. I'm in my work now. So unfortunately, you did not formulate. You recognize the significance of finding and results. Unfortunately, you did not. The management plan was very lacking. As I said, you did not talk about the stepwise approach of controlling the manic episode, and the risk management also was not enough. So the point number 5 and point number 3 are not going to be scored for you. You did not say that you are going to talk with your patient or explain anything or assess or be in contact with your patient. So definitely point number 4 is not going to be scored for you. Does not identify appropriate psychological social interventions. You did not talk about any social intervention. So what are you going to do when the patient is going to be discharged? At least make sure that when he is going to be discharged, at least to be followed up with a nurse, okay? Your communication was good, perfect. All the points of communications are good. I like the way you are communicating, and also it was organized, though it is lacking, but it was very good. Again, this is not a pass or fail, though, just to help you how you are going to be assessed. Okay, so someone was raising his hand, but I was busy talking about the...
Dr. Hossam, I have another question, sorry, just to kind of understand things. So you said that we should talk about what to do, like social support and on discharge for the patients. Yeah. Okay. I was just wondering, because it sounded a bit, I don't know, I haven't done the exam before. I was just wondering if we should say it, even if the nurse doesn't invite that question, can we still explain that?
Yes, you must say it, because you are setting a plan. It's about how you are going to manage this plan, this patient. Okay. You have admitted the patient, so what? So you know your reasons for admission. So what are the reasons for discharge? Is going to stay always in the hospital? We know that there is a short-term and there is long-term management steps, isn't it? You definitely know this. So on the long term, you are going to discharge the patient, and you are going to do so and so. Okay, thank you so much. Someone has been raising his hand. I don't know.
Oh, no, sorry. I was just indicating that I'd like to go next.
Okay, so what is your name, doctor?
Mo is fine.
Mo. Okay, so what is your station, doctor?
Metabolic syndrome.
Okay, doctor. Metabolic syndrome. Okay, you have 3 minutes. You ready?
Yes. Please, what's the name of the patient?
Let's say that my name is Elizabeth.
Elizabeth.
We'll start now. 1, 2, 3, go.
Hello, Elizabeth. My name is
Hello.
Dr. Yobu. I'm one of the psychiatrists working today in the clinic. I understand that you've come to discuss your recent blood test, and I was hoping that we could talk about that now.
Yes, it will be helpful to understand more about this test because nobody has asked me about talking with someone when the results come.
Sorry, I didn't hear that.
Excuse me?
I didn't hear what you said, sorry.
No, this is the first time for me to have this experience when the results of my regular and routine blood tests come. Nobody asked me to consult someone. Anything wrong with this blood test?
Okay, Elizabeth, I can understand your worry since normally you don't speak to someone after you've had the blood test. But following your most recent blood test, we've seen that there are some abnormalities in that, and that's why we're having this conversation. I'd like me to share the results.
Okay.
Okay, so some of the blood tests that we've done for you are to check your blood sugar, which we found out that is a little raised. Your cholesterol levels, which is the fats in your body, is also slightly raised. And we've also done another test checking your a measurement of your waist circumference, which we've also seen that is higher than the normal range. And I wonder if this is something that anybody has spoken to you about before.
No, this is the first time to hear this, so I don't know what would be the reason behind these results.
Okay, so that's what we're coming to right now. And I'll ask you a few questions regarding that, if that's okay. So has anything changed for you recently?
Like what?
So have you gained weight recently? Have you noticed that
Yeah,
you've
I
gained?
felt that I've gained a bit more weight.
Okay. And has anything changed that has made you gain weight recently?
Like what?
So exercise wise, is that something that you'd normally do?
Actually, I didn't notice any particular reason, but I felt that I was gaining weight, though that I didn't feel that I was eating more than usual.
Okay, that's understandable. So I understand that you're on a medication called clozapine,
Yeah.
For schizophrenia, and you've been stable on this medication for the past couple of years. Is that right?
Yes, yes.
So this medication you're on, as well as some other factors, can contribute to what we call metabolic syndrome. Have you ever heard of this before?
So, no, what is this metabolic syndrome?
So this is a situation where people's blood pressure, their blood sugars, and their weight can increase, all because that they are on some medication and because of some aspects of their lifestyle.
I see. I see.
Okay.
So, is it serious, doctor?
So the good thing about it is that if we pay attention to it and monitor the person's bloods, their lifestyle, we can make some changes to it. Would you like me to share about this for you?
Yeah, yes, it would be very helpful.
Okay, so I'd like to first ask some questions. Are you taking any other medications?
No, I don't. I'm not taking any other medications.
Okay, and is there any stress that you're going through right now?
No, actually, my life is very stable now.
Okay, that's good to hear. And diet-wise, how is your diet?
Well, I'm eating as usually, I'm not that very keen to eat healthy food, and at the same time, I'm not the one who's always on junk food.
Okay.
Just eating like anyone else.
Okay. And for you, you do have any medical problems?
No.
Okay. All right. So there are a couple of things that we can do regarding this metabolic syndrome that I'm talking about with the raised blood sugar. We can involve the dietitians to help a healthy meal plan for you, and so that you can choose more healthy food that can help to reduce your blood sugar, such as choosing complex carbohydrates over junk food.
I see.
Then another thing we'd like to do is to encourage you to do some more exercises if that's something that you would like to do.
Yeah, I think it can be helpful, though I feel that I have bad knees actually.
Okay, so we can work with a physical therapist that can give you exercises that can be tailored to your physical, so that you don't do more.
Okay.
Okay. And I was wondering, do you smoke or do you drink alcohol?
No.
Okay. All right. So another thing we can do is we'll continue to monitor your blood, the bloods that we've done for you. So your blood sugar, your cholesterol, and to make sure that we monitor it a bit more frequently to make sure that it's improving in the way that we like it to improve.
Okay.
Yeah. And do you have any other questions for me before we go on?
No.
Okay, thank you very much for having this conversation with me. I can give you some leaflets about metabolic syndrome so that you can understand a bit more and know what else you can do regarding this problem.
Okay.
Thank you very much, Elizabeth.
How do you feel about it? Actually, you still have 1 minute.
Oh, sorry.
Okay. So give me a feedback about how do you feel about what you did. Very important to have your eternal feeling about what you did.
I think it needs a bit more structure. So it feels like it was a bit over the place, the structure of this. So I think that's one of the things that would be good.
Please give her some feedback. It will be very helpful, and pay attention to the feedback of your colleagues. All of them are experienced psychiatrists, and most of them have experience with the cast. So it will be very helpful to know more about their own feedback. تفضل يا عم سؤال. مفيش واحدة اتفضل. So let's see, I'll give you, when I ask you why am I having this blood test duration, just answer my question and then go back by signposting to what you want to discuss or what you want to ask. I think you could explain the, it was good explanation of the metabolic syndrome. It was good, but it could have been better. And still, doctor, though it is a metabolic syndrome, please pay attention to this. Though it is a station about metabolic syndrome, and you might argue, so this patient is controlled and it is a metabolic syndrome. So, but still ask about risk. Why is that? Because there is a point in the mark sheet about the risk. Okay, though it is about the, because as I told, it is a game. If you don't know the rules of the game, definitely you will go through this station with your mind that this is a metabolic syndrome. There is no need to ask about the risk, whether I can say any concerns about the safety of the patient or etc. No, there is a mark sheet in the paper, in the mark point in the mark sheet for those who ask about the risk. So you must ask about the risk to make sure that you are going to score for yourself this point. So you did not ask about this. It was a bit disorganized because while you are talking about the management, you asked me about the smoking. You should ask about the smoking before talking about management. Take enough information to have a background to set the management plan. Don't take the information while you are talking about the management. So you gather the information to do the formulation, which you didn't do, and then talk about how you are going to solve the problems of the patient. But don't talk about how you solve the problem of the patient and at the same time you gather information about the problems. This is a disorganization. Okay. So let's see the feedback of our colleagues. Very helpful. For me, it's also helpful. Essential time still finished exactly. Long term still showing more. She forgot about medication adding statins. No, an aripiprazole adding statins if adding statins is something which it is resorted to the GB to assess whether it is a suitable condition for statins. Okay, but we don't add statins by ourselves. Okay, let's see. An aripiprazole, definitely very good information. We should talk about aripiprazole as a management for the metabolic syndrome. Let's see, according to the okay. Okay, so you introduce yourself. By the way, you have a good communication skills. You have good rapport. I liked it. As I said, why am I having, when you get the question, why am I having these deranged blood tests? Immediately address her concerns. Don't let her on tense until you gather some information. According to the blood cells, it seems that you have so and so. What could be the reason for this? The metabolic syndrome. And here is a simple explanation. I hope that you have screenshot. Sometimes they can just find it difficult to explain what is metabolic syndrome. It is a disturbance of the metabolism which caused changes in the blood chemistry, like increased blood sugars and increased blood lipids. And also pay attention to this, there is a change in the energy consumption, which cause increased weight, and weight circumference is also increased, and also the blood pressure is increased. So this is the metabolic syndrome in simple, okay? Changes in the blood chemistry and energy consumption. Is it serious? If it is not managed properly on the long run, can have serious blood vessel problems and hypertension and diabetes and heart problems. Why am I having this metabolic syndrome? Most probably clozapine. However, there are some contributing factors. You should ask her about the possible contributing factors. So we want her to ask her about her medications. Psychologically, is she taking her medications? Ask about the unusual experiences. Ask about the typical day in her life. So you want to know whether this patient is having sedentary life. So these are the biopsychosocial information. ask about the underlying medical problems, etc. These are the medical problems. Psychologically, as one of your colleagues said, you want to know more about her mental state and how much she is strict in taking her medications. And socially, if she's having a sedentary life, take me through a typical day. Any physical activity? Are you keen to eat healthy food? Do you smoke? Do you drink alcohol? Do you use street drugs? And eventually ask about the risk. As you can see, this is the area which you gather the information, and this is the only area which you gather information. We don't talk about the management, and while we are talking about the management, we talk about whether she is taking smoking, if she has physical problems. No, this is a total disorganization. Are you following me, doctor?
Yeah.
Yeah, so again, we are going through, this is our stepwise approach: introduction, explanation, gathering the biopsychosocial information, risk, formulation, and management. We are in the step of gathering the biopsychosocial information, which will help us to do the formulation and set the management plan. So the biological information, as we said, if she is having any medical problems, if she has any chest pain, any family history of heart problems, hypertension, or obesity, okay? Psychologically, you must talk about the psychological problem, because she might need to change medications, or just ask about the clozapine if she's taking medications, and if she is having any psychiatric disorders, any psychiatric symptoms. And socially, their lifestyle and risk. Very important to ask about the risk. When she asks you, how are you going to help her? Immediately start by formulating. So she has resistant schizophrenia, she's controlled by clozapine. However, she's having metabolic syndrome, which carries risk, etc. All this on the background of having no other medical disorders, social stresses. Why we can say this confidently? Because we have already gathered all the information which can help us to say the formulation without any mistake. Now, regarding the management plan, as I always say, you only have 90 seconds. If you are very clever and organized, I don't think you can have more than 2 minutes or 90 seconds. So first thing, what are you going to do and where the patient is going to be treated? So definitely you want to follow her up regularly in the clinic to address her concerns and to do physical and mental assessment while she is following up with the new management plan. Sometimes maybe you want to do some investigations to make sure that she is fit for physical activities or any change in her medications. So she must do some blood tests like liver functions, kidney functions, heart rate, etc. Okay, so these are the typical stepwise tests. As you can see, same sentences, but make sure that you say them, because with every sentence is reflected in the mark sheet. And there will be T will follow her up physically and psychologically and socially. Physically, very important to talk about the physical part, because you are going to communicate with the GP regarding the high blood pressure and the high lipids, etc. Definitely, this is something which the GP is going to follow her up with, and that's it. You are not. This is not your job to write statins or control the blood pressure, etc. Make sure that she's going to follow up with the GP in order to control all these derangements. Okay. Psychologically, it is recommended, and this is something very important, you did not say it. It is recommended not to change the clozapine. However, if the metabolic was not controlled, we might add aripiprazole, which will help controlling the metabolic syndrome. Okay? Okay. Yeah. Regarding the social part, this backbone of the treatment is the healthy lifestyle. Very important to say this. The healthy lifestyle is the backbone. It's not the problem of the medication, the healthy lifestyle. She added weight because she is not having a healthy lifestyle, though she is taking clozapine. Many patients are taking clozapine without increasing their weights. So we can help her by joining a subsidized gym. This is some sorts of gyms for the mental health patients with discount. So this is subsidized gym, and also would be helpful to book an appointment with a dietitian. And how do you feel about having an appointment with alcohol or substance use services if she mentions something related to smoking or alcohol? Okay. And termination, give her leaflets about what you have discussed. So this is how you manage a metabolic syndrome and how you address all the questions which might be raised. So the most common mistakes here in the management, definitely, you don't formulate. not talking about that you are going to communicate with the GP to control the blood pressure, etc. It is not your job to control these medical problems. If you are going to change or add a medication, you must talk about the investigations. Regarding the medication, the clozapine, don't change the dose of clozapine, but you can add aripiprazole. And eventually, the common mistake that you don't talk much about the healthy lifestyle, joining exercise, gym, and the dietitian. That's it for the metabolic syndrome. I'm not going to go through the mark sheet again. I think I've talked about it in 4 stations. This is enough. So thank you so much. I hope that you found it helpful, doctor.
I did. Thank you.
Okay, who would like to go next?
Can I go next?
Yes, doctor.
Well, okay. Two
Me,
patients.
Dr. Anas, I use both my name.
Yeah. Okay. Who?
I already put my name, Anas.
You did put your name before, so sorry. So I think
Yeah.
this will be the turn of Dr. Anas, if you don't mind, doctor, with all respect. So open your cam, Dr. Anas. Okay. So what is your station?
Pediatric overdose.
Okay, we will put it on the screen now. Okay, so you will have 2 minutes.
What is name of nurse?
Michelle.
Nurse name and
Michelle.
Michelle. Mr. Michelle. Okay. And patient name, Miss. Sorry, patient name.
What? Let's say Lisa. The patient's name is Lisa, and I'm Michelle. I will be the nurse.
Okay. Okay, doctor, I'm ready.
Okay. 1, 2, 3, go.
Hello, Mr. Michel. I'm Dr. Anas from Mental Health Unit. I understand that you have some concern regarding Miss Lisa.
Yeah, doctor. I don't think that she should stay anymore in our department. I have a busy word. She is now clear. She claims that she took an overdose. She is now physically stable, and I feel that her place should be in your ward. So I hope that you help us and take her to your side, if you don't mind.
Yeah, I understand your concern and how much busy you have in your work, how much. I gathered that, yeah, medically stable, but what do you know so far about her mental state now?
Well, all I know that she is making a chaos. She is shouting from time to time. She wants to go out of the word. Her stepfather wants to talk with her. We are all on the edge because they said that she attempted suicide. We don't know whether she's going to attempt suicide in our ward again or now. We are not, trained to deal with these patients, so it is not helpful for us or for her to stay in our side. if you don't mind, please order to take care.
Yeah, it sounds so difficult and so risky, especially she recently attempted suicide. And I'm here. I will address with you all concern how we could help her during this critical period. But unfortunately, I could inform you that we don't have available beds in psychiatric ward.
Well, actually, it is something which is going to complicate the matters because, as you can see, we are not trained to deal with these situations. Our ward is not planned to accommodate such patients, and it's making it quite a chaos. And there are a lot of problems which is apart from our speciality. So definitely, this is not helpful for her, and I hope that you sort this out.
Yeah, sure. So to explain to you why we need to keep her in medical ward at that time. So I understand it must be in psychiatric ward, but unfortunately because no bed, so we have to keep it in even if medical ward, as there are high risk about her. She has severe depression, and she already attempt serious suicidal attempt. In meantime, there are some allegations about could be some abuse from her stepfather. I don't know if you aware of something from this.
Well, I have no idea about this. If he wants to see her, so we did not give him
yet,
and we don't know what to do with this situation.
Yeah, it was decision to not allow him to see her, as she mentioned, she put in paper that there are some sexual abuse from her stepfather. So we need to see more. So until to finishing this critical, and in meantime about suicide, she recently attempted suicidal attempt. That will be risky to go home, in that time. So
but she's trying to leave the word from time to time. So what can we do?
In that time, we will try to calm her down. I will provide for you psychiatric nurse, which expert in dealing with these cases, so she can talk more with her to calming it down. And there are some medication will helping her. And if all failed, we can apply Mental Health Act to not allow her to go out.
Well, how about informing her mother? Because I feel that she wants to talk with her mother. This can be a helpful step.
I think in meantime it's difficult. Bear in mind that her mother in psychiatric ward, so it will be difficult for her to understanding that. So maybe later we can arrange family with her mother.
I see. So well, it seems to be a complicated situation, doctor. So how are you going to help her then?
First, I would like to again see her frequently, and I would like to talk with other nurse staff in the medic to explain to them her condition, and close monitoring by psychiatric nurse. And that all right so far?
Yes.
Yeah, and the most important point now to inform the forensic psychiatry to investigate more regarding the allegations, and we have to raise concerns to social services. We need to see if there are other children in house could be abused, right?
I see.
And regarding medical, we will do more investigation to ensure her fit for medication. Some regarding heart tracing and liver enzyme and kidney enzyme. After that, if there are any agitation,
1 minute remaining.
If there any agitation or uncooperation, we can help by short-acting benzodiazepine. And we, after assessment, we can start antidepressant because it will helping her, like SSRI, it will helping with her mood in that time. Are you okay so far?
Yes, yes. So
Before discharge, we have to make sure that her home is safe for her, no more stressor, no any problem, and to ensure that she taking medication regularly. And we can talk with the school to arrange for her leave because the school is for medical reason.
okay, time. How do you feel about what you did?
Thank you.
Give me feedback about what you did, Dr.
I didn't plan for, I didn't make what I planned for.
Okay.
I was like to start by gathering instead of starting by MORBID of the in psychiatric ward, but I don't know why I did this.
Okay, so give him some feedback, doctor. So he did not formulate, please, doctor. This girl is already medically cleared. Pay attention to the information given to you. They are supposed to be professional. Someone who is already medically cleared, she had attempted suicide, definitely. She doesn't need to do more investigations. I don't know why did he say more investigations. And pay attention to what he said. There are no kidney enzymes. Pay attention to these terms. It does not reflect professionality. If you ask any lab, do for me some kidney enzymes, he will say what I'm talking about. We don't know exactly whether she is having depression or what she's passing through the psychotic episode. So when you talk about the medications, mention the possible, you are going to manage according to the final picture. If she has depression, you are going to use an antidepressant from the SSRI group. And if there is a psychosis, you are going to use aripiprazole. Pay attention to this, doctor. When they put for you a child for a reason. So when you talk about the medication, you must talk about a particular medication suitable for this age group. Exactly when we talked about the elderly mania, we talked about the mood stabilizers, and we mentioned that it is not suitable for him to use olanzapine or risperidone because they carry risk of strokes in the elderly. So if it is a child, definitely when you talk about the medications, you must mention that you know that there are some medications which are recommended for this age group. So if there is a psychosis, talk about aripiprazole. If there is a depression, talk about the use of a safe SSRIs like fluoxetine, something of sertraline. So let's see the feedback. Let's see the method. No, this is not method. Sorry. Pediatric. Yeah. So this is our notes, and let's see how we're going to do this station. Your introduction was good. You addressed that you are talking with a nurse who is not very comfortable with the presence of this patient, and I like this. But there's a thing which is very important, which you have missed. Now, you are talking with someone who is considered to be a caregiver, a nurse. So what do we do?
Yeah.
We must do what in the very first beginning and show that you are professional. We know how to start discussing a condition or a case with a nurse. We must take a handover. Okay, say that I want to take a handover. Say it clearly. I would like to know more about the patient and take a handover from you about her. Okay, how is she doing? You know more about the difficulty he's having. So socially, you want to know exactly what are the difficulties he's having with the presence of this patient in the ward, and any information about her life circumstances, because definitely he will mention that her stepfathers want to see her and so on. So this is social part. Psychologically, you have seen Miss X, and however, I would like to know more about her psychological condition. Does she express any hallucinatory behavior? How about her sleep and appetite? So this is psychological part. Very important to ask about the risk, something which you didn't do. This station is all about the risk, doctor. It's very important. Someone who has attempted suicide. So I've gathered from those that she is medically stable. I'm wondering if you have any concerns about her safety. How about the safety of others? Okay, not his. Okay, are you with me, doctor? So
Yeah, I explained for that. Yeah.
and finally, what are the management steps done so far? So this is the handover. You take the biopsychosocial information together with the risk in addition to the management steps done so far. So this is how you start talking with a nurse. They don't bring a nurse for no reason. They don't bring a child for no reason. They don't bring for you an old man for no reason. When they bring a nurse, they expect from you to show the consultant how you talk with the nurse. So how we talk with, I take a handover. What is a handover? Gathering the biopsychosocial information and the risk, and what are the management steps taken so far. So this is how you start talking with a nurse. Now you explain for the nurse the problem and what's going on in order to make sure that this man understand what you are in and what are you going to say. Okay? And you must use some sentences which is appropriate for a defensive man, or he's not very forthcoming. So I appreciate the efforts so far done in taking care of Miss X. From our discussion, it seems that Miss X has severe depression and she has attempted serious suicidal attempt, and she needs extensive management for her mental condition. In addition, there are allegations. You don't say that they are facts, you don't know yet. There are serious allegations against her stepfather, which needs to be assessed before letting her go back. Unfortunately, there is no available beds in the pediatric ward, so she needs to stay in the medical ward until there is an available bed. So you explain to this man what's going on. Okay, do you have any question? He will express his discomfort from your decision and so on. Okay, so show empathy. There is a considerable amount of communication skills in this particular station, and this is the main complaint of the candidates about the attitude of the nurse. They instruct the nurse to be very defensive if he feels that the candidate is not empathetic or he doesn't care about the problems he is having with the presence of the patient in his ward. So pay attention to this. So when he expresses discomfort, don't ignore it. So you must say something in order to address this discomfort and show empathy. Understand how much busy work you are having and the difficulties, so on, and your concerns about her presence in the work. However, I'm sure together that we can help her as much as possible, rest assured. So this is a set total paragraph in order to show your communication skills and not letting the role player escalate his defensive and negative attitude, okay? So say to him that you are going to help him, you are going to show you understand the problem he is facing on, and you're going to send a nurse and so on. When if she tries to leave the word, you must talk about the applying the Mental Health Act. If her step was to see her, definitely this is not allowed because of the serious allegation. You must verbalize there are serious allegations, and it is not allowed for him to communicate with her. However, he can book an appointment to talk with one of your team members, okay? So this is how you answer these questions. All these questions you are going to be asked in this station. Can we inform her mother? So from the scenario that the mother is already admitted in the psychiatric hospital, so the best answer here, saying that the incidents and the details are very hard, bearing in mind that her mother has depression and is admitted in a mental health hospital. I would like to discuss this point with her treating team before taking this step. So this is the best answer for the role for this nurse who wants to inform the mother. You must discuss this step with the treating team before talking with the mother, informing her that her daughter has been admitted with a suicidal attempt. The formulation, pay attention to the formulation. There are a lot of things to say here. So Miss X has depression, attempted serious suicidal attempt. She is now medically stable. However, there is high risk on her because of her mental state. All this in the background that there are serious allegations of sexual abuse from stepfather. She has no past psychiatric history, but there is positive family history of psychiatric disorder, or her mother is suffering from depression. So this is how you talk about the formulation, and make sure that you talk about the formulation before talking about the management steps. And as you can see, the management steps is very important. Okay, it is very important to be organized in order to cover all or most of the points which will help you to pass. what are you going to do, and where she's going to be treated. So because of the high risk and the series of the allegations, I am going to discuss the condition with the consultant and the forensic psychiatric team. Pay attention to this. Say something which will make you distinguish from the other candidates. Definitely, there is a role here for the forensic psychiatric team. Also, I'd like to see Miss X again to explain her diagnosis and address her concerns and to do thorough risk assessment. So you have a patient who has attempted suicide, and also there are serious allegations against her stepfather. So definitely your consultant should be informed, and also there is a big place here for the forensic psychiatric team to be involved. She will stay in the medical ward. You will follow her up regularly, and she's going to be escorted by a psychiatric nurse with safety precautions taken to prevent her from harming herself. Okay, so you can see in the beginning there are important management steps other than the medications. Discussing this with the consultant, forensic psychiatric team, we are going to see the patient, and also there will be a nurse which will follow her up in the psychiatric ward. Regarding the investigations, she already has done a lot of blood tests. However, I would like to double check them. Okay.
Yeah.
You must say the important sentence, a team which will cover all her needs physically, psychologically, socially. Physically, she's already medically clear, so there's no place here for the physical, talking about the physical she's already physically stable. So socially, for the allegations, and because of the allegations, and bearing in mind the possibility of the presence of other children, I want to make urgent referral to social services. Pay attention to this information, doctors, please, because these are the reasons that the candidates do not pass this station. They think that it's all about admitting the patient in the psychiatric ward and giving her some medications, and that's it. They miss these important points. They show that you know how to manage such complicated cases. So you must talk about the social services and inform the child protection officer with the relevant agencies and the police as well. So this is very important. Okay, are you with me, doctor? Psychologically, a short course of benzodiazepine, very important to calm him down, improve her sleep pattern, and to decrease the risk of any impulse to hurt herself. So this is benzodiazepine. If there is underlying depression, you are going to use SSRIs, and if there is psychosis, you are going to use aripiprazole. Okay, a talking therapy definitely is going to be helpful, and eventually termination. Tell him that you are going to give him your number. So as you can see, a lot of points which are usually missed from the candidates in these complicated cases. They think it's all about admitting the patient. No.
Thank you, doctor. Thanks.
Hi, doctors. Sorry for the interruption. Hope that you find it helpful, Dr. Anas. Do you have any question?
Yeah, no, thank you, doctor. Thanks.
Okay, pay attention to what I've said. It's not about admitting the patient to a psychiatric ward and giving her some medications. The details in the scenario are written in order to challenge your professional skills to know, are you able to manage these complicated cases or not? Okay, I hope that is clear for you. Okay, who would like to go next? Okay, Dr. Bassam. Assalamu alaikum, Dr. Nufal.
وعليكم
What?
السلام باسم.
So,
Olanzapine weight gain.
okay, I'm going to share the screen. Olanzapine weight gain. So,
Okay.
ready? So,
Yep. What's the patient's name?
his name is Robin.
All right.
Okay. 1, 2, 3, go.
Good afternoon, Mr. Robin. My name is Dr. Malak. I'm part of the
Hello, Dr.
psychiatric health services in this clinic. I understand that you're discussed
Hello.
concerns about.
I cannot hear you, Doctor.
Can you hear me now?
Yeah. Yeah.
Raising my voice? Should I raise my voice? Is that better?
No, it is interrupted, but you can continue. Continue, please.
Okay. I understand you're here to discuss you're concerned about some weight gain that happened over the recent time, and you wanted to discuss that.
Yes, yes, I'll gain a lot of weight, doctor. I don't know exactly what is the problem.
Can you tell me more? How much weight did you gain over what period of time?
Well, I'm weighing now 120 kilograms, so I don't think that this is something good. I think it's all because of the medication stuff.
I understand you are currently on olanzapine and you've been diagnosed as having schizophrenia.
Yeah,
And
yeah.
you started back on olanzapine over the past 6 months.
Yes, yes, yes.
Over the last 6 months, how much weight did you gain?
Well, I don't know, maybe 20 kilograms, something like this.
Okay. And this, from my understanding, also that this was happened previously with olanzapine early at the previous time where you stopped the medication.
What? I didn't hear what you were saying.
This has happened previously again when you when you were
Yes,
on
yes.
olanzapine.
This is not the first time for me to have a problem with the weight because of olanzapine. It's not a good medication regarding this issue.
Okay. Do you mind if I ask you some more questions regarding the other medications that you've tried?
Okay.
Have you tried any other medications?
Well, yes, I tried aripiprazole, I tried Sequel. All of them did not help me as olanzapine, but the problem is that olanzapine is causing a problem of weight gain.
Okay. I'm sure that has caused you a lot of concern and a lot of worry about your weight and your health, your physical health. We'll try to address this while right now and see how we can help you with that. So you've said you've gained 20 kilograms in the past 6 months,
Yeah.
and with olanzapine, we have regular follow-ups about your physical health, like every 3 months after starting the medications. Were there any concerns in the past lab results?
No, no. Only problem that continuously increasing weight.
All right. And there was your GPS followed up your blood sugar, your
Yeah.
your lipids, your blood pressure.
Everything is okay, but except that I feel that weight problem. My weight is a problem.
I understand olanzapine is one of the medications that causes significant weight gain. So I understand your concern. There are several things that we can do in order to address that, that weight gain. But in order to further understand and make a plan on how we can help you, is it okay to ask you, for example, how's your lifestyle? What do you do? How's your daily routine?
I'm a computer technician, so most of the time I spend not less than 12 hours in front of the screen. It's definitely not a very healthy thing to do, but this is my job.
Okay.
And I sleep about 8 hours every day, something like this.
And how's your eating habits?
Well, I'm not very keen to eat healthy food. I don't cook, so I eat mostly the takeaway, some of them junk. That's it.
Mhm. If I may ask, do you drink alcohol?
No, no,
Do you smoke cigarettes?
no,
All right. I also understand. Do you have any other medical conditions that you're taking medications for?
no, no.
All right. From what you described, you've been diagnosed with schizophrenia, and you were started on olanzapine earlier on, and you stopped it because of the weight gain problem, and it caused the relapse. And now the problem has arisen again, and you've gained 20 kilograms over the past 6 months. There are no laboratory complications that were done in the previous tests, and your GPS followed up with you regularly, and there's no concerns. In that sense, you live a more because of your job, you're chair bound. You don't have much physical activities, and you're eating more food that not so healthy food. I would like to help you. Did I miss anything?
No, it's all about 1 minute remaining.
I would like to ask you to do some blood work. I would like to ask you to do some blood sugar, fasting lipid profile, and also check your urine for check your urine for normal urine analysis. I would also like to do a complete physical exam and measure your vitals. And to check up on you, and we will be doing that more regularly in order to manage your concern with weight gain with olanzapine. There are different things that we can do. We can the first and the cornerstone of the treatment of weight gain is a healthy lifestyle. We can help you with that in order refer you to a subsidized gym, or and also help you to refer you to a dietitian to help you manage your food with your current lifestyle.
Time. How do you feel about what you did? Give me feedback.
It wasn't the structure that I wanted. I went back and forth between. I used a lot of the information I read, which is I shouldn't be repeating as much. The management, I was extremely squeezed. I did not do management. It was
Okay, so
yeah, it was not good. Yes.
no, it's good. As long as you're trying, it is good. It is not good if you are not trying and you are not addressing your mistakes. Definitely, it's not good. So Your introduction in the very first beginning, remember that first impression persists. When you introduce yourself, make sure that you don't do any mistakes in the very first 6 seconds or 5 seconds. There's no problem. Why do you mess up in your introduction? And I really appreciate that you did this mistake just to demonstrate that you are definitely a very experienced psychiatrist, yet a simple skill like introducing yourself, you messed up in the very first seconds, and I don't know exactly what part, if addressing yourself or addressing the patient, you messed up. But as you can see, it was not a very good impression to start with. Many times you repeated I gave you simply that I don't have any medical problems, and all the medical checkups was okay. I don't know why you could continue digging up in this area, asking me if I'm following up with the GP and what are the results. Did you do any blood tests? I summarized everything. Everything's okay. So don't waste your time with this issue. Let's see our metabolics. Olanzapine weight gain. So remember how to practice on your introduction, as I said. Now, the good thing that you took from me, my complaint, you want to know exactly what is the problem. So what is the current weight problem? What is your current weight? You want to know more about the weight problem. How much weight did you gain? Since when did you feel that you started to gain weight? Anything happened around this time? So you started to start this medication 6 months ago. So from his perspective, it's all about the medication. What was your weight at this time? But pay attention that at this time, I gained 20 kilograms. So and my weight now is 120. So when I started taking olanzapine, I was already overweight. So you must pay attention to this information. So this man is already overweight. The medications are not that bad for him. The problem is that he is already is having this tendency to gain weight because of his lifestyle. Okay. And now ask about the course. So do you feel that the weight is still increasing? Anything in particular helps with it? And when you ask about the course, you will find that he is totally blaming this medication. Okay. And before the onset, I've gathered that you have started gaining weight X months ago. I'm wondering, before that time, how were you doing in stresses? It is the first time to have an increased weight. So you'll find also that this man, because of his lifestyle, his weight has been fluctuating around heavy weight, trying to decrease it, heavy weight, and so on. So the first thing you do after the introduction is to understand more about the problem of the weight, the current situation, what from his perspective, what increased it when he started to gain weight, what was happening at this time, and before gaining this weight, is it the first time for him to gain this weight? Okay, any stressors, and so on. Now you want to know more about this man in general, to gather the biopsychosocial information in order to help you to understand the problem of the weight gain. So socially, take me through a typical, which you did, the lifestyle, how many hours does he sleep, okay, his job, physical activity, are keen to eat healthy food. You ask about, please don't forget fizzy drinks, very important. It's not only the alcohol and small fizzy drinks, okay, street drugs. And how did this problem of weight affect his life? Because he feels that he is not confident as before, and so on. Very important to ask this question while you are assessing his social life. Rapidly assess the psychological problem. If he is doing well on olanzapine, is he is taking it regularly, and if he has been trying any other medication, something which you already asked about. Now, regarding the medical, very important to ask. You ask about a lot of medical issues, but very important to ask about exactly if he is having thyroid problems. So you kept asking me, do you feel any medical? Maybe I have physical. From my perspective, I don't have any problem, but he might have thyroid issues while he doesn't know. So you ask me, show the examiner that you are professional. Any change in the way you feel to hot or cold weather? What about the bowel habits? any past history of heart problems, any complaints when you do any physical activities. Very important to ask about the family history regarding the weight gain. And I think in this station, he has positive family history regarding the weight gain and diabetes, I think, or weight gain and heart problems. And eventually ask about the risk. Very important to ask about the risk, even in weight gain problem, because there is a point related to the risk assessment in the mark sheet, not because of the subject of the scenario. As I told you, it's a game and you must know the rules of the game, and the rules of the game are in the mark sheet. Now, pay attention to the following, doctor, because the task here is saying to you, discuss, they want for you to, I think in this station, they also wants, I forgot here, the level of motivation. In this station, they want from you to check the level of motivation. So pay attention to this piece of information in the task. Okay. So check the level of motivation while you are explaining the problem. So you gathered enough information. Now you explain for him what's going on. I appreciate all the information. It seems that there is a problem of weight gain. However, there are other factors in your life behind the weight gain other than medications like eating habits, etc. Check the motivation. How do you feel about taking steps toward controlling your weight? Do you feel motivated to do this? Okay, this is an important part in the task. Okay. Now you do your formulation. He is having controlled schizophrenia. However, there's a problem of weight gain which is not managed, can impact his medical condition. All this on the background that he's having unhealthy habits, no underlying medical problems, and there is a positive family history of heart problems. Now, regarding the management, what are you going to do, Dr. Basim, and where the patient is going to be treated? This is the first thing which you are going to say. I would like to see you more regularly in the clinic to assess your mental and physical state and the level of risk and to address your concerns. So you want to see this patient more regularly to make sure that he's following you up and implementing your management plan. Now, the second point, the investigations, as you can see, a cliche, typical sentence. Number one, what are you going to do and where the patient is going to be treated? Number two, the investigations, the liver functions, kidney functions, and blood sugar level, blood chemistry, to exclude any physical disorder, okay? And there will be a team which will cover all his needs socially, as you said, and when you talk about the biopsychosocial, the sequence depends upon the station. So in this station, you start by the social part of the plan because it is the most important part. So the backbone is to control, is the healthy lifestyle, as you said. How do you feel about having appointment with a dietitian, joining a subsidized gym? Any problem with the movement, we can consult a therapist, a physiotherapist, okay? Psychological, it is not recommended to change olanzapine. However, we can add another medication called aripiprazole or metformin. Again, these are common steps taken to control the weight gain from the medications. And also talking therapy and group treatment can also effective in adopting healthy life habits. Physically, regarding physical problems, definitely you are going to liaise with the GP, eventually terminate by giving him lipids. So this is how you talk about the weight gain. Pay attention to the points which I've just mentioned, particularly the motivation. As you said, the healthy lifestyle is the thing which you start with. But when you talk about the medication, don't forget the aripiprazole. Okay. Thank you so much, doctor. I hope that you found it helpful. So who would like to go next? Who would like to go next? Have we finished? Okay. So thank you so much. It was really a pleasure and a privilege to be with you. I really missed doing these Zoom sessions with you. I hope that you at least doing one station every day. Not one station, at least 5 to 6 stations every day. Your exam is very soon. Please focus on the management stations. It is very important, and the passing rate is low. However, I hope to see all your names in the pass list and the honor list, which I do for every CASC test. Okay, good luck and good night. Bye-bye.